Hi guys, my name is Frances. I'm a nurse midwife and I'm a registered nurse in the UK. So I'm practicing as well in the UK. How are you guys doing? How was your day? All right. So how is your day going? Okay, that's fine. Please don't forget to share, don't forget to comment, don't forget to subscribe, please guys. All right. Today we'll be talking about in-hospital resuscitation. It's one of the clinical skills and oh, I must tell you the fact, in hospital resuscitation is an exhausting procedure. You definitely get tired along the line, but don't give up. Keep pushing, okay? You will definitely get it at the end of everything. All right, guys, so let's go. So, what is in hospital resuscitation? It's all about you trying to resuscitate somebody, someone who is lifeless, who might be having cardiac arrest. Okay, all right. So, today I'll first of all explain the procedure to you, then I'll dive into the practical. I'll do it for you to see how it's going to be. So don't worry, everything you need is here. So just feel free, make sure you watch the video to the end, subscribe, and it will be very helpful to you, I assure you. Okay, all right. So it's a 6 minutes procedure. Of course, people who are pregnant cannot do this procedure, it's very exhausting. Okay, so don't worry, pregnant mothers, you're exempted from this procedure. Okay, but just try and learn it. You never can tell if nursing council might want to change anything at any time. Okay, all right. So in this procedure, just like I mentioned, it's 6 minutes. So what you do here is, of course, you are trying to resuscitate somebody. You now start performing, doing almost all the checks. So but what you will do is, I approach my scene, I see my scene is safe to approach, nothing to trip me or fall, I'm happy to proceed. I'll move, you quickly move to the person. Hello, you shake the shoulder. Hello, can you hear me? Patient is not responding. You press the emergency buzzer. Somebody help me please, somebody help me please. Okay, then you go back to the patient. Hello. Of course, you shake the shoulder and the person is not responding. So you make sure the person is, if the person is lying by the side, sorry, this is an improvise. If the person is lying by the side, you turn the person onto the back. Just this way. The person will be lying onto the back. Okay, so you do a held tilt chain lift maneuver. How do you do it? You tilt the head, you lift the chain. I'll do it again. You tilt the head and you lift the shin. What are you doing it for? For you to check for any obstruction in the airway. So if there's no obstruction in the airway, you do look, listen, and feel. What are you looking for? You're looking for the rise and fall of the chest wall, if there is any obvious rise and fall of the chest wall. So I can see this patient, there is no obvious rise and fall of the chest wall. So you listen. What are you listening for? You look, you put your ears to the person's mouth to see if the person is breathing. So if this is not there, you keep verbalizing it, keep saying what you're doing. In the OSCE, you'll be seeing a mannequin. So that's what you'll be using for the procedure. So you listen, the person is not breathing, then you feel. When you feel, you put your hand to the person's cheek to see if there's any hair coming out from the person's mouth. So you verbalize that there is no hair coming out from the person's mouth. Then you feel the carotid pulse. So there is no carotid pulse. Please make sure you're showing the examiner all these things. You feel the carotid pulse, the carotid is not pulsating. Okay, so what do? You've established all these facts and the person is not breathing. For 10 seconds, you're establishing all these things. Okay, remember 10 seconds. All right, so before doing this, remember you called for help and your helper is there. So once your helper, before you start doing this, and your helper, definitely the helper will say, okay, I'm here, what do you want me to do for you? Remember to tell the person, please hold on. It seems I have a lifeless patient. You're not sure yet. Okay? So now you have checked all those things. You've looked, you've listened, and you felt the carotid pulse. You feel as well the hair coming out from the person's mouth, but there wasn't any of this. So you now start your chest compression properly. Okay, so but before starting your chest compression, remember your helper is still there. You tell the helper, please call the resuscitation team, call 2222, then get the resuscitation equipment. Call 2222, Call the resuscitation team, then get the resuscitation equipment. You mentioned these three things, okay? So then you now initiate your chest compression. How do you do the chest compression? You're giving this chest compression with, you are giving 100 to 120 cycles per minute. 100 to 120 cycles per minute. So in 1 minute, you are giving 100 to 120 cycles of chest compression. Okay? All right. Then you're giving, for each of them, you're giving 30 compressions to 2 rescue breaths. What are you using to give the 2 rescue breaths is an ambu bag. So you're using ambu bag to give 2 ventilations. Okay. All right. So when doing this, you make sure that your non-dominant hand is on top of your dominant hand. So the dominant hand can take charge. All right? Are you understanding me? So for example, I'm a right-handed person. So I'm using my right hand. My right hand will be below my left hand. Then I'll form a lock, making sure that the heel of my hand is at the lower half of the sternum. Okay, so the lower half of the sternum is what the heel of your hand will be resting on. So please make sure you don't compress the abdominal muscles. Verbalize it. Keep on verbalizing. It's good to verbalize. Keep on telling the examiner that you know what you're doing. So make sure you don't compress the abdominal muscles, the ribs. Okay, all right. So then you are giving this compression at the depth of 5 to 6 centimeter. 5 to 6 centimeter. All right. So you form a seal. Make sure your elbows are locked. Make sure it is straight. Don't worry. The examiners will set the bed for you according to your size, according to your height. Okay. So don't worry about that. I'm just using this for an example. So I'll lock my hand. I'll make sure my hands are straight. I'll lock it. Make sure the dominant hand is under the non-dominant hand if you are right-handed. So if you are not right-handed, I think this will be more comfortable for you. So you place your hand this way at the lower half of the sternum, then you give 30 compressions. You give 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 30. Then you give 2 ventilations with your ambu bag. So you make sure while giving the ventilation, the ambu bag is forming a seal around the nose and the mouth of the patient, and ensure that there is no seepage of hair from the sides of the ambu bag. So you give the ventilation, you give 1, you wash for rise and fall of the chest wall. While you're doing it, you're washing for rise and fall of the chest wall. And make sure before you put the ambu bag, you tilt the head of the patient. Is it understood? Hope you're understanding me. Okay, so you get the ambu bag, form a seal around the nose and the mouth of the patient. Then you give the ventilation. You wash for rise and fall of the chest wall. You give the second one. You wash for rise and fall of the chest wall. Make sure the 2 ventilations are given within 5 seconds. It shouldn't be more than 5 seconds. Just be verbalizing it, okay? Keep verbalizing for your examiner to know, to understand that you know what you're doing. All right. So after doing that, then your examiner might want to interrupt you along the line and ask you, okay, the resuscitation teams are here. So what do you do? So you need to do your handover, which is the S-bar handover. So you introduce yourself. My name is Frances. I was walking along the corridor. I'm a nurse working in the medical unit. I was walking along the corridor and I saw this patient lying on the floor. So I established the fact that the patient wasn't breathing. I look, listen, and feel. So everything you've done, you explain to the examiner, to your resuscitation team that are there. So I listened, and I felt the carotid pulse. There wasn't any of these that was in place. So I went ahead and do the chest compression. So I've given the 30 compressions, the first 30 compressions to 2 rescue breaths, and I've given the second one as well before you arrived. So make sure there is something you need to know, please. When you are giving these compressions, you might be on the third one and your examiner wants to interrupt you. Please complete the cycle. That's a tip. Please complete the cycle. Give the 100 to 120 cycle per minute. Then even if your examiner says, okay, your resuscitation teams are here, they might want you, the examiner wants to purposely know if you know, wants to understand if you know what you're doing. So make sure you give the chest compression, the cycle, to complete the cycle. All right, okay, so you now hand over. Okay, so I was given the 30 compressions. I've given one cycle before you arrived, or I was about completing the I was giving the one I was at the one cycle per minute before you arrived. So just know how you're going to put it. So I suggest those patients might be suffering from cardiac arrest. So I'm also suggesting that the patient is taken to the ICU, which is intensive care unit, for further checks. And that is it. So your examiner might want to ask you what are the causes of cardiac arrest. So you can use there is this acronym 4H, 4T. So what are the 4H? Hypovolemia, hypoxia, hypoglycemia, hyperkalemia, hypokalemia. So hypokalemia slash hyperkalemia, they are both the same. So don't say, okay, you've mentioned the four, but I'm sure the examiner will not want to ask you the whole 8 of them, just for you to know it, so you don't miss out anyone. Okay, so the other T's are tension, pneumothorax, cardiac tamponade, toxins. Okay, all right, so that's it, guys. So at the end of the procedure, if you still have time, or you still of course you might, I think you will finish before your time once you're fasting while you're doing. So you tell the examiner that before the procedure you were supposed to perform hand hygiene, but since the patient is lifeless, you want to save a life, so you dived into the procedure, so you perform your hand hygiene. So I'll perform my hand hygiene according to WHO guidelines. I'll put an ample of alcohol gel on my palm, rub my hand palm to palm, right hand over left dozen with fingers interlaced and vice versa. Palm to palm with fingers interlaced, fingers interlocked, fingers interlocked, rotation of the thumb, tips of the finger, and the wrist. I'll allow my hand to dry for 30 seconds and I'm happy to proceed. Then you will now stay calm and listen, refresh. Just maybe if you have time, just start thinking of what have I not done, what have I done, what have I not done. So you try to fix all those things back. All right, guys, hope you enjoyed the video. Hope you enjoyed it. If there's any question, feel free, honestly, feel free to ask me any questions at all. I'm ready to give you the answer. Okay, thank you, guys. Please subscribe to my channel, share to your friends, like, comments. All right, thank you, guys. I'll see you in my next video. Thank you.